Joseph Lister, 1827-1912. Title: Antiseptic, Joseph Lister. Learning objective: you will be able to explain how the problem of infection in surgery was overcome. Learning objective: describe the ways in which the problem of infection in surgery was overcome during the 19th century. Explain in detail the work of Joseph Lister and why there was opposition to his work. Excellent progress. Evaluate the extent of which antiseptics transform surgery. Joseph Lister watches Robert Liston perform the first operation on an anesthetic in 1846. What are the sources of infection in this picture? There's quite a few. Robert Liston, 1794-1847. Surgery mortality rate, 300%. In 1837, Liston published Practical Surgery, arguing the importance of quick surgeries. These operations must be set about with determination and completed rapidly. Richard Gordon was an English ship surgeon and anaesthetist. He describes Liston as the fastest knife in the West End. He could amputate a leg in 2.5 minutes. He is reputed to have been able to complete operations in a matter of seconds at a time, when speed was essential to reduce pain and improve the odds of survival of a patient. Friedrich Runge isolated carbolic acid from coal tar in 1834. A number of scientists recognized the efficiency of carbolic acid in preventing decay and neutralizing the stench of dead animals and human cadavers. Frederick Calvert, Alexander McDougall, and Angus Smith in Manchester promoted a powdered form of carbolic acid as a deodorizing agent to treat municipal sewage across the United Kingdom, most notably during London's famous Great Stink of 1858. Jules Lemaire, Gilbert Declat, and Enrico Bottini were pioneer surgeons who used carbolic acid to treat wounds and control infection, establishing the effectiveness of the antiseptic agent before Joseph Lister's landmark 1867 publications. Jules Lemaire, 1814-1873, France. Pioneer of antisepsis, Lemaire is recognized as one of the first to understand the nature of wound infection and to utilize carbolic acid, then known as coal tar acid, for surgical purposes. Clinical application. Following earlier work on coal tar, Lemaire adapted a formulation for clinical use in 1859. He wrote extensively on this subject between 1860 to 1862 and published a major work on phenol carbolic acid in 1863. Gilbert Declat, 1827-1896. Pyrenean French physician, recognized as an early advocate for antisepsis in sterility in surgery. Inspired by Louis Pasteur's germ theory, Declat was among the first to argue the necessity for sterile environments in surgical procedures. Phenol therapy. In 1865, he published his seminal work, which detailed the use of carbolic acid, phenol, to sterilize wounds and prevent infection. Declat famously engaged in a long-standing dispute with the pharmacist Jules Lemaire over who first discovered the antiseptic properties of phenol. Enrico Bottini, 1835 to 1903, in Italy. Bottini was an early adopter of carbolic acid in Italy, using it to treat hundreds of patients with supportive wounds. In 1866, Bottini published his experience with 600 cases, demonstrating the practical application of carbolic acid in surgical practice before the widespread adoption of Listerism. Before Lister popularized the use of carbolic acid in 1865 to 1867, both Lemaire and Bottini were already working in the field, contributing to the shift toward antiseptic surgery by addressing the hospital diseases, such as gangrene, femia, that cause high mortality rates in the mid-19th century. Thomas Anderson, Joseph Lister's colleague in agricultural chemistry at the University of Glasgow, told him about carbolic acid and its use in the Carlisle sewage works. In 1864, I was struck by an account of the remarkable effects of using carbolic acid upon the sewage of Carlisle. It prevented all smell from the lands covered by the sewage and destroyed the parasites that usually infest cattle feeding on such land. The idea of using carbolic acid for the treatment of open fractures naturally occurred to me. In 1865, Joseph Lister began to use carbolic acid in open fractures to treat patients undergoing surgery. Joseph Lister developed and created the carbolic acid spray machine. Used in the late 19th century to create an antiseptic surgical environment, it was commonly nicknamed the donkey engine. Due to at times strenuous hand-pumped and noisy operation, it was later refined into a steam-powered device known as a carbolic steam spray, or Lister's carbolic spray. In preparation for surgery, everything was soaked in a 1 in 20 solution of carbolic. Hands, instruments, and patient's skin. The entire scene of the operation or dressing was enveloped in a spray. Data taken from Joseph Lister's record of amputations that he carried out between 1864 to 1870. In 1864 to 1866, without antiseptics, total amputations was 35. 16 of them died. That's 45.7%. Between 1867 and 1870, with antiseptics, we had 40 total amputations. Only 6 of them died. That's 15%. What can you infer from this source about Lister's contribution to surgery medicine? Was his method of antiseptic surgery a success? Was it a total success? This is a good point in the video. You may like to pause the video and match the statements with the appropriate explanation. So let's match the statements with the appropriate explanation. People had not yet accepted the germ theory. This meant that surgeons did not recognize the benefits of using carbolic spray. They thought infection was caused from inside and not from germ outside the body. Extra work was involved in creating a more sterile environment. This meant that surgical procedures became more expensive. It took more time to ensure that everything was sterilized. This meant that some surgeons who believed in the importance of speed when carrying out operations were against these methods. Lister did not show off or give impressive public displays about his methods. He also appeared cold and superior. Consequently, people were not easily convinced about his new ideas, either because they didn't hear about them or because they didn't want to accept them. The carbolic acid used in antiseptic surgery was harsh on the skin and unpleasant smelling. As a result, it cracked surgeons' hands and created an unpleasant working environment. Surgeons had got used to the idea that their work inevitably involved a large number of their patients dying. Consequently, Lister's new methods were simply met with disbelief. Lister can also be credited with a number of developments in antiseptic surgery. From the late 1880s, operating theatres and hospitals were rigorously cleaned. From 1887, all instruments were steam sterilized. Koch developed the steam sterilizer. In 1894, sterilized rubber gloves were used. Halstead asked the Goodyear tire company to produce them. Lister also developed sterilized catgut ligatures. Masks in closed operating theatres all followed later. The work of Lister was the main factor in solving the problem of infection after surgery. How far do you agree with this statement? If we agree, we can say, before using antiseptic, 67% of patients who had amputations died from infection after. After using antiseptics, only 15% died. Operations were now possible because there was less danger of infection. In the 1880s, the first appendix operations were carried out, and in 1896, the first heart operation took place. Lister was given an award at the Sorbonne University in Paris for his contribution to the fight against disease. Lister was made Professor of Surgery at King's College Hospital in London 1877. Lister became a Baron in 1897. He had his funeral in Westminster Abbey. Hospitals have been named after him since. Now, if we disagree with the statement, we can say a lot of credit has to go to surgeons like Jules Lemay in France and Enrico Bodoni in Italy, who had already used carbolic acid on hundreds of patients to control supportive wounds. 15% of patients undergoing surgery died. The only reason why Lister's ideas were accepted is because Louis Pasteur had come up with the germ theory in 1861. Lister merely applied Pasteur's ideas to surgery. There was a lot of opposition to Lister. Surgeons criticized Lister's methods because they felt that antiseptics prevented the body's own defense mechanisms from working. In review of today's lesson, we can describe the ways in which the problem of infection in surgery was overcome during the 19th century. We can explain in detail the work of Joseph Lister and how he overcame opposition to his work. We can also evaluate the extent to which antiseptics transform surgery. Please remember to like, share and subscribe to the channel. I'll see you in the next lesson. Thank you and goodbye.